We've learned a lot about the coronavirus since it hit the U.S. earlier this year. In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker finds out ways outcomes are improving even as the next surge is raging across the U.S.
Even though University Hospital says they have not seen an uptick in hospitalizations, they have seen hints about a possible upcoming surge, which is why learning more about the disease is so important.
We still don't have easy to give outpatient therapies, but we know more about the disease.
Dr. Thomas Patterson, the lead COVID-19 infectious disease clinician at University Hospital and chief of infectious diseases at UT Health San Antonio, says more knowledge about the disease has allowed more patients to stay at home.
Increasingly, patients can get diagnosed and stay at home, but then we're seeing patients with more progressive symptoms need to get admitted to hospital.
Studies of remdesivir here in San Antonio have also improved the effectiveness of the drug.
It showed that remdesivir produced quicker recovery times, and even though it wasn't powered for mortality, the mortality was about 30% less.
They've even found ways to help patients breathe easier while in the hospital with simple techniques.
We have learned about some other adjunctive measures that seem to improve outcomes. So proning, or turning on your side or stomach or front, helps in some patients produce better outcomes.
This multi-pronged approach has also decreased mortality rates.
I think the mortality rates here in the U.S. are substantially less than we've seen in other parts of the world.
Even though it appears that mortality rates from the coronavirus across the world have gone down, we still don't have a vaccine, so we must continue to wash our hands, socially distance, and wear masks. Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find the rest of the Wear the Gown stories. Just go to wearthegown.com. We'll be right back with your 7-day forecast.